Hi, welcome back, guys. So today's video is just going to be dispelling some myths about nurses and nursing. Just to remind that I'm just going to be dispelling. So number one of those myths is that nurses are assistants to doctors. Nurses are assistants to doctors. Back home in Nigeria, this kind of is like the kind of is like the general belief that okay, nurses are under doctors, they are assistants, they're. But coming to the UK, I'm just going to dispel the myth generally that this is not true. This is not true. Nurses are no assistants to doctors. In UK here, we know we have what we call multidisciplinary team, like MDT team. Meaning in that team there are a lot of people. There are professionals in that team. You're a nurse, you're a doctor, you are a lab technician, you are a support worker, all those all these different professions come together to make up the multidisciplinary team. And without one of them, the team is not complete. So it's seen as a team, and then everybody have their contribution to how things are done, to achieve patient's care, like get patient safety, achieve patient safety, like, and make sure that safety is the team word, and then the patient is okay, the patient is well at the end of the day. So that's the goal, that's the general goal, and everybody has this in their mind. So everyone works together to kind of achieve this goal. So nobody's under the other. Nurses are definitely not assistant to doctors. They are professionals. And when you are a nurse, like, your contribution is important, your contribution to the overall care of the patient. You will be asked questions like, what do you think we should do for this patient? What do you think we should do for this? What do you think we should do in this situation? Are you happy for us to discharge your patient? You understand? You're taking care of a lady, you're the one in charge of the lady's care, the patient's care. You have your contribution as a nurse, you have your contribution towards the safety of the patient. You can't leave it to the doctors, you can't leave it to the support worker. You have your contribution towards the care. So you are not an assistant, you are a professional, okay, as a nurse. And that's number one myth. The second one is that all nurses work in the hospital. All nurses don't work in the hospital. There are different areas you can work as a nurse. Wherever you are, wherever you're working, there are different areas you can work as a nurse. You can work in the ward, you can be a travel nurse, you can work in the care homes, you can work anywhere. You can work in the prison, you can work in the mental health hospitals. Everywhere care is necessary to be rendered, a nurse must be there. You understand? There are different specialties. You can work in the theater, you can work in, like, inside the hospital. Now you can work in the theater, work in different wards in the hospital. You understand? So nursing is varied. Like, there are a lot of different specialties, and that's one of the things I like about nursing. You're not condemned to a particular place, you're not condemned to a particular thing, like you have to do this thing as a nurse. Either you do it or you're not a nurse again. You can go anywhere to work, you can work in any department. You understand? So that's number two. And number three is that nurses only serve drugs. Nurses don't serve only drugs. It's not only drugs that nurses do. Nurses contribute towards the care of the patient. Like, they actually care, and they provide emotional support, and they do drugs, and they do other things as well. Nurses don't just serve drugs, they there are nursing diagnoses. Nurses make diagnoses too. Look at the patient, the overall health. Okay, what is wrong with my patient? What can I do to alleviate his or her suffering? What can I do to make her better, make him better? What can I do to take away the pain of this patient? Nurses do that. They interact with the doctors as well. Okay, look at what I think it is, look at what I think we should do. What do you think? You understand that interaction? Nurses do that. That's what nurses do. Nurses don't just serve drugs, they don't just serve prescribed drugs. If that's what you're thinking in your mind, nurses don't just do that, okay? So that's one of the myths. Number four myth is that you have to be uh female, a woman, a girl to be a nurse. Hey, who said that? Anybody can be a nurse. Whether you are a man, you are a woman, you are a boy, you are a girl, you can be a nurse. All right. No particular gender is condemned to be a nurse or not be a nurse. You can be a nurse as a man, you can be a nurse as a woman. And same thing with midwifery. You can be a midwife as a man or as a woman. Like, it's not condemned. We have made midwives in our hospital, and it's amazing working with them. You understand? So you can be a midwife, you can be a nurse, whether you're a man, you're a woman. It's not condemned to a particular gender. Same thing with doctors as well. You can be a doctor as a woman, as a man. You understand? So it doesn't. Okay, so it's not condemned to a particular gender, and that's just a bonus tip, and those are the things I want to dispel. Like, those are the myths I want to dispel as regards to nursing. Thank you so much for watching. If you like this video, click on the like button, and don't forget to like, share, subscribe. Thank you so much. Bye.